Roseman University College of Medicine has embarked on an ambitious goal to create a community-embedded independent college of medicine. A core element of making that happen is the Genesis program. Genesis is an experiential service learning opportunity for medical students. Its primary form of service is achieved through a series of home visits to medically underserved households. These household visits will not be your traditional medical home visit. It is more focused on educating household members and learning more about their realities as healthcare consumers. During the medical student's first year, each student will be assigned 2 households. Medical students will have a longitudinal experience anchored by these home visits with these households that will span all 4 years of medical school. Many ask why Roseman College of Medicine feels this approach is so important. Well, Genesis exists at its core because of a theoretical foundation called household-centered care and the ability to teach students about the social determinants of health. Household-centered care is the provision of care to all members of a household, regardless of their familial relationships. This approach reflects the understanding that providing care to one member of a household without considering the needs of other household members is counter to an understanding of the social determinants of health. Genesis will also offer students the opportunity to experience firsthand how the social determinants of health, or where people are born, live, learn, work, play, worship, and age, influence the health outcomes of medically underserved populations. Opportunities to reinforce classroom instructions on patient engagement, cultural humility, and ethics is yet another benefit to Genesis and its home visits. So what are the goals of Genesis? There are many goals of Genesis, but at its core is to improve the health and social conditions of participating household members. There are also many Genesis learning objectives for the medical students. Some may be to describe the historical and economic development that influenced health disparities in Las Vegas and how it led to the creation of the Genesis approach. It may be about identifying the 3 social factors that can continue to impede the vitality of Las Vegas's underserved areas. We will also look at health disparities common to the Las Vegas Valley. It'll also be very important for students to understand and apply the concepts of household-centered care, as well as to introduce the integration of Genesis activities into the clinical practice courses that students are expected to take. So as faculty members, they are a key component to making Genesis successful. And they do that through 3 very important ways. First, they educate students on the core concepts needed to successfully perform home visits. Second, they prepare students for household visits. And finally, they supervise all home visits. So for them to be able to do this effectively, we need to make sure that our faculty are ready. Faculty will participate in a Genesis readiness process that includes SDOH and household-centered care boot camps, readiness home visits, Genesis technology platform trainings, as well as the standard faculty development for implementing the Roseman University College of Medicine curriculum. Genesis policies and procedures include the details of how to perform safe and consistent home visits. So now it's time to get started. And this video provides some very basic overview of what Genesis is. There are many additional details that will be shared with you during the coming weeks and months. We are excited to have you join us on this journey to offer medical students the unique experience while providing a benefit to communities in need. Welcome to Genesis.